Hello, my name is Detlev Boison. I'm professor and vice chair of research at the Department of Neurosurgery at Robert Wood Johnson Medical School. I'm also chair of the Neurodegeneration and Injury Focus Area Working Group from the Brain Health Institute. The big picture of my research is to understand mechanisms that turn a healthy brain into a diseased brain. More specifically, we are interested in mechanisms that link a precipitating injury of the brain, such as a trauma, stroke, status epilepticus, or exposure to pathogens or chemicals, to the development of acquired pathology, which includes epilepsy, Alzheimer's, or Parkinson's. Over the past 30 years, my laboratory has focused on the metabolic basis of epilepsy and the role of astrocytes in epilepsy, with a specific focus on adenosine and the adenosine metabolizing enzyme adenosine kinase. These research topics are highlighted in two articles I published in Nature Reviews Neurology in 2022, The Metabolic Basis of Epilepsy and Astrocytes in the Initiation and Progression of Epilepsy. Conventional epilepsy therapies focus on symptoms and neither prevent nor modify the underlying disease. More than 20 anti-seizure medications are currently used to decrease neuronal excitability, increase inhibition, and reduce the likelihood of seizures. These drugs act on a dozen different pre- and postsynaptic targets, which are mostly ion channels or targets that control the activity of those channels. Unfortunately, despite the constant development of new anti-seizure medications in recent decades, rates of drug-refractory epilepsy have remained stable at over 30%. Furthermore, many of those who do achieve seizure freedom with anti-seizure medications contend with serious psychiatric and physiological side effects. No treatment is available to prevent or modify the development or progression of epilepsy, and most anti-seizure medications are ineffective in treating the cognitive and psychiatric comorbidities associated with epilepsy. The development of novel disease-modifying therapies will necessitate a transition from single-target approaches, which tend to be symptomatic in their effects, to globally acting multimodal approaches which can restore complex network function. The conceptual innovation of my overarching research philosophy is illustrated in this figure. If the base of the pyramid depicted here is disrupted, as it is in epilepsy, treatment strategies that only affect the top of the pyramid, like most anti-seizure medications, will have significant limitations. Methods to exploit gene regulation therapeutically are still in their infancy, and the therapeutic potential of epigenetic, biochemical, and metabolomic approaches constitutes a new frontier in therapy development. In the past, my lab has focused on developing therapies to locally increase the concentration of the brain's endogenous anticonvulsant adenosine, with the goal of preventing seizures through increased activation of inhibitory adenosine A1 receptors. This work has been published in journals such as Brain, PNAS, Biomaterials, and Journal of Clinical Investigation. More recent discoveries from my lab have shown that adenosine has additional adenosine receptor-independent functions through biochemical interactions with the transmethylation pathway, which controls DNA methylation. We have shown that this epigenetic function provides the mechanistic basis for disease-modifying properties of adenosine and its potential for epilepsy prevention. In my future work, I plan to focus on the disease-modifying and anti-epileptogenic properties of adenosine-augmenting therapeutic strategies. This approach leverages the principles of network pharmacology. Epileptogenesis is a multifactorial network phenomenon which requires the rational targeting of several central nodes implicated in the epileptogenic process, as opposed to single-target symptomatic pharmacotherapy. Adenosine is an ideal candidate for a network pharmacology approach due to its integral position in several pathways of relevance for the prevention of epilepsy, which includes seizure suppression and neuroprotection through adenosine A1 receptors, inhibition of inflammatory processes through adenosine A2A receptors, and prevention of maladaptive DNA methylation through interference with the transmethylation pathway. The adenosine system is a uniquely well-situated target for the development of disease-modifying therapies for epilepsy and likely other neurodegenerative diseases because of these multimodal synergistic effects, thus enabling a more comprehensive design philosophy than conventional target-centric approaches, which fail to be effective in about 1/3 of all persons with epilepsy. Future work will focus on epilepsy prevention, treatment and prevention of comorbidities of epilepsy, and prevention of sudden unexpected death in epilepsy. My lab is currently funded through an R01 grant to study the role of adenosine in the epileptogenic process. I have published over 200 papers with an H index of 71. Thank you very much for your attention.